Okay, everyone, thank you and welcome to our Lunch and Learn here for February on the CBRNE protocol, the chemical, biological, radiological, nuclear, and explosive hazard protocol. Thank you for joining us here at the Polk County EMA. My name is Brett McIntyre. I am a program assistant here with EMA on the training and exercise side, so I am in charge of organizing these monthly Lunch and Learns. In the back, I've got my counterpart, Cameron Stufflebeam, who works with a lot of our hazmat planning and planning efforts and the LEPC coordination as well. So if I defer questions to Cameron from time to time, he's going to try to hide in the back, but I'm going to single him out here a bit. But I'd like to introduce our panel, and then I'll go through a few housekeeping issues as well. I'll start with those. I'll introduce the panel next and hand it off to them. In terms of the layout of our building, if you've got your lunch or anything to drink, we've got some coffee over here on the side of the room, right below the AED. So in case of emergency, that's what that is. If you need a little bit extra to drink other than coffee, if you go back through our break room doors here in the back, straight through the break room, into the hallway, there is a bottle refilling station there. There's also some vending machines if necessary. If you need the restroom today, just go back out the way you came, around the hall on the back side of our two conference rooms here. That's where the bathrooms are. So out the front and make two lefts into the hallway. You'll find the restrooms right there. If we do need to evacuate the building at any point, again, the easiest way is right back out the way you came here through our lobby. If for whatever reason that exit is not available, we can go out the side door here, which will take us into public health and out the south side of the building. And then rally points would be at the south end of the parking lot there on the street of Carpenter Street. Other than that, I think we are ready to go ahead and get started today with our Lunch and Learn. I'll have a few more pieces of information at the end of the seminar today on what else we've got coming up. And we do have for each of the spots there an evaluation form, short evaluation form. We would greatly appreciate it if you fill those out before the end of the day. You can either turn those open, leave them on the desk, and we'll collect them, or you can leave them up there at the front desk. We're always interested in your feedback, both on the seminar of the day and any requests that you have going forward. We like to put these on and be of value to our partners, of topics that you would like to hear, or even better, like to present about, so I don't have to go around and twist people's arms. But the less that we're up here talking and the more it's information and learning shared from all of our partners, I think the better that these are to inform everyone. So thank you for your support there. In the meantime, we've got Matthew Shroyer here from Iowa Homeland Security and Emergency Management. I'm going to kind of turn things over to him here in a minute to kind of lead. We've got Lieutenant Colonel Stephen Wallace here with the 71st CST, and then from Des Moines Fire, Special Operations, Tad Stoner and Obie Meyers here as well. Again, we've had some updates and changes to the protocol. They're going to kind of give us a walkthrough overview of some of those of the things, as well as the protocol in general. Maybe I'll look forward to other things on how to make changes or suggestions, and we can kind of learn from each other, have some open discussion as well. So we do have microphones here for our panel. If you can go ahead and turn those on, you get a green light. It's not so much for in the room, but it is for our recording that will get posted to our training website after we're done, probably by the end of the day tomorrow, so it can be shared, reviewed for anyone that needs to go back and look at anything, shared with anybody that wasn't able to make it today. So with that, I'll turn it over to Matthew, and he can kind of get us started, and Cameron and I will kind of help moderate from there.
Yeah, I'll cover the background of the CBRNE protocol. Who here is familiar with the version from 22 years ago or so? Yeah, I see some familiar faces in there. Well, that document, when it was written, was also, I was a member of the 71st Civil Support Team back when it was created, and the CST kind of spearheaded that initiative back then. Maybe spearheaded's not the right word, but they were involved in a panel. So we've kind of kept that model, and this update was long overdue. So that document was when CBRNE response in the Homeland was kind of a new thing after 9/11, after anthrax attacks. It was a highly technical document, almost a reference document for the subject matter experts. And over time, we realized the responder level needs something now, especially we've got 20 years of experience, response teams, both civilian and military. And so the initiative was started pre-COVID to rewrite the document. Then it obviously froze because of COVID. And we picked it back up, this is about when I started with Iowa Homeland Security. So our whole intent was to get it to a level that your responders in small town Iowa, volunteer fire departments, police officers can pick up this document and know what their initial steps need to be. We don't need to tell the CST or Des Moines Hazmat how to do their job. We need those guys that don't deal with CBRNE. And we really kind of took all hazards, not just CBRNE in like a weapons terrorist form. This is more of an all hazards look at it. And so we'll talk about it a little bit more, but the main concept that we started with, and I believe it was Captain Suarez initial, we kind of came up with the concept of RAIN, RAIN. It's recognize, avoid, isolate, and then notify. So that was kind of the concept we were going with for the different hazards. So as you look through this document, and I'd encourage people out there, so it is publicly available, but it's not public facing, if that makes sense. So you can, if you have the URL, you can get to it, but we just didn't make it public facing for a couple of reasons. One, if we put it on our website and it's public facing as a program, one, then it has to meet all kinds of different specific PIO requirements that this type of a document is really challenging to make fit those. And then the other reason is, again, this isn't intended for the general public. It's intended for responders at the local level to use this document. So that's where we were going with it. I don't know if Des Moines wants to talk a little bit more about the RAIN or the.
Yeah, so the RAIN format is kind of developed with the hazmat awareness level in mind. Obviously within larger departments, you know, we get firefighter 1, firefighter 2 certifications. That comes along with a hazmat awareness and hazmat operations level certification. So obviously we know in rural communities, they might not have the personnel to be able to put people through that formal level of training. And so that RAIN process or structure really kind of conforms to that hazmat awareness level of certification. So it's based on, like you said, the recognize, avoid, isolate, and notify. And so it's kind of the initial steps for, like you said, an all hazard approach that kind of align with that awareness level of certification without having to go through the certification process of having that awareness or certification.
So the original document was, I'll apologize if I'm wrong. I want to say it was 170 almost pages. I think 160 some. We're down to less than half that with this new document. So we really trimmed some of that technical jargon out of there and tried to get it to a more usable document. So we did start with the original protocol and we started kind of what should we keep, what should we not keep. One thing that we did keep in here that's big for people to know is a telecommunicator specific section. So if your 911 dispatchers are getting information, it kind of gives them information on what they should be telling that responder to do too. So you see it there under tab 1, it's telecommunicator information for helping recognize the potential hazard. So that's step 1, is trying to figure out, if you can, what type of a hazard are you dealing with? And then the annexes after that will go into the AIN portion of the RAIN acronym, because once you know what you're dealing with or have an idea what you're dealing with, then there's some differences in how you're going to approach those different types of hazards. One of the things I want to make sure I say before I forget is that you probably saw on the beginning of the document and at the end, there's a place for feedback. We're highly encouraging anybody get your hands on this document, look through it, submit feedback on that Google form that we have, because we're, instead of what we did before and wait for this document to be antiquated and updated, we're going to try to convene this same group of at least agencies. People change, but the agencies, we'll try to convene it annually, take in that feedback, see if it makes sense, see if we want to incorporate changes and keep this document progressing, as opposed to wait 20 more years like we did the first time. So yeah, be happy to take any questions. Huge thanks to Colonel Wallace here in the 71st, because we had gotten a document that we really liked, and then he went through and did the hard technical work of making the links jump to where they're supposed to and all that, so you can use it digitally. So thank you for that.
If I could speak to that. So, as we discussed in the early planning of this document, we really wanted to make it a tool that first responders could really have available on scene, et cetera. And so there was a little bit of effort, as you can tell, to make it more digitally friendly, right? So that's a trend, is everybody seems to have a device on their. If you go to the front page of this, you'll see the QR code there that Matt talked about. If you zoom in on that a little bit, you can, if anybody, you take your phone out and you take a picture of that QR code, it'll take you directly to the online version of this. So if you need a copy of it, the intent there is that, you know, prior to a scene or whatever, you can have this digitally on your phone, right? And the other thing that's we had talked about in the progression of this is it helps with versioning. Because if you print off a copy of this and then changes are made and this goes on your shelf or whatever, and then you have the old copy of it, as feedback is makes this document better and makes the process better. It's always good to know or have confidence that you have the latest version. And so this creates the ability, as long as you rewrite that version over at the same link, that if you're not sure if you have the latest version, you just follow the QR code on the front of it and it'll take you to the updated version. Meaning that if you have an old copy, and as long as the link doesn't change, you can, if you want to check to see if it's been changed or it's a new copy, just follow that link on your desktop, on your phone, and you can compare the two. So that was one goal of it. The other parts of it were really the legibility, meaning that if you're looking at it on a device, a phone, a tablet, a laptop, or something like that, well, you need some navigation tools, but otherwise you're going to be scrolling through the whole thing. And so we put some of those in. That was really the whole team's input on that is, and so it's supposed, the idea behind it as far as from a use case standpoint is that, you know, as you're sitting there, or your ops person in that incident command is looking at that you can quickly navigate it because you got other stuff to worry about. So that was one other objective that I think that we improved on it. There's probably some more improvements that can be done. But and then to what Matt was saying about the feedback form, if you go to the last page or even at the bottom of the first page, I believe there's a link there. Not the cover page, but that page, the table of contents. Right there, there's a page for leaving feedback, or a link right there. So on that digital device, you can open that and it'll take you to a digitally filled form that he was referencing that you can at any time put some feedback in there. And I think the key part of this really is that that it needs to be kind of a living, breathing document, and it really needs to serve the customers who are using it. So that initial first responder, firefighter, IC, et cetera, that's the feedback that we want to capture, because we can have great ideas you know, at each organization, but if it doesn't really serve the purpose, and we don't get that feedback, then it's not going to.
And you know, we talked about the responder levels that we'll use it to, and I had DNR reach out after September or October-ish when we published this, and DNR field staff is now in possession of this, and they'll use it on anything that they come across too. So really, it's not just police and fire. It's anybody you can think of that might encounter, you know, it could be security, facility security personnel, anything like that. So anybody who you think might encounter a threat, you know, something jumps out to me, it'd be maybe like the Iowa Event Center staff, their security staffs, things like that. So again, they can get through these initial steps to up to notify. So a CST or hazmat team or whoever can be activated, but they're doing the proper steps in the meantime.
One thing that I'd add to that is the value of the document is really kind of up to the user of it, and there is some what I'm looking for applicability to it to each user. So scroll to page 12. At the end of each section, it has a section that's kind of designed to be filled out by the user on top of it. So put in, make sure you know what your EMA number is and those emergency contacts, as well as the Department of Homeland Security, and making sure that this document is tailored to the individual that's using it. So some important numbers that and some sections that allow for it to be personalized to that user.
Yeah, and that's a good point too. One thing we want to, as our department is, and the way Iowa operates as a home rule state, we don't want to cut out those local emergency managers. So our number is listed there, but if you can't get a hold of your county emergency manager, you can call that number 24 hours a day. That's our general office number. But after hours, if you hit 0, it goes to DPS's comms and they'll contact our duty officer. So we don't want that necessarily to be your first number that you call, but that's there in case you can't get a hold of your county EMA. It should go through your county first. And then, you know, you can always ask for technical assistance through the CST or the other specialty organizations that are out there. We're not saying don't do that. This is just, you're going to want your emergency management personnel to be notified as soon as possible. So.
I think we're kind of spoiled in central Iowa. I think a lot of the agencies that are represented here have a really good working relationship. So for us, getting a hazmat call is a pretty easy process as far as activating that hazmat team. Probably take that for granted. There's a lot of other smaller departments out there that, you know, this is probably a lot more gray what that activation looks like. So give some guidance to that.
Can you walk us through just that activation for some of us in the room that may not be familiar with that, even in Polk County?
So when we go around to a lot of other departments and make our spiel to them, we are part of the hazmat team. We represent basically Des Moines and most of the surrounding counties as well too. We can be, as a hazmat team, we can be activated by any fire service or law enforcement personnel. That activation depends on the county and the emergency manager. They kind of dictate what that activation looks like. Typically goes through dispatch. Some emergency managers say, go ahead and make the activation if you feel necessary. And then just let the emergency manager know on the back end. Other emergency managers want to have that approval process from their department. So it's really county specific on what that activation of the bus looks like. Like I said, it has to come from fire service or law enforcement. And then once that activation is made, we can provide a range of service from a phone call. Lieutenant Meyers and myself always make ourselves available. We have someone on call 24/7 to field phone calls, answer questions. We want to really provide the research aspect in a lot of cases, or just consultation piece, all the way up to a full-blown hazmat response, depending on the scenario. So a lot of times people might have questions that they know in their mind that they don't need a full-blown hazmat response, but they just want maybe a little bit of guidance. That's something that we're certainly able to provide as well. To that, I'd say, like I said, we have a lot of good working relationships. We kind of see ourselves as kind of a link to a lot of other resources. We work very closely with the CST, Homeland Security, State Hygienics Lab, postal inspectors, SWAT teams, bomb squads. We have a broad network of resources that we're able to access. Same for the CST and any of those other partners. So that's kind of the role that we fill in those cases.
So you mentioned the State Hygienic Lab. Could you jump to that section, please? Yes. So the SHL is train with Des Moines, they train with the CST, they train with the other WMD hazmat teams throughout the state on sampling. But we also realize that even without the training, the opportunity might present itself to where somebody else will have to sample, and I wanted to touch that here. So it covers a little bit here, but it really only going to want to do that at the non-trained level with them on the phone, because they'll walk through the process. So we left out some of it was a very detailed sampling section before. In this case, we kind of brought it back to the basics, because if you're not actively communicating with them, you probably shouldn't be taking a sample. So I wanted to kind of touch on that a little bit. So I don't know. It's been a little while since I did any of the sampling training and stuff, but that's still kind of the product. Yeah.
Yeah, and it's really even for the CST, the protocol for how we sample, how we package samples, how we transport them, et cetera, it really needs to be driven from the state lab. And that kind of speaks to what I had said before about as those protocols or something changes, this document can really change as those recommendations are made, and it doesn't need a, you know, the impact to the field really doesn't need to be, it can also almost be seamless, meaning that you just follow the link again, and that's the new document that you get will have the latest protocol. So it's kind of one of those things where you find yourself on the scene, it's always good to, at least if you haven't checked the latest link or something hasn't come out to tell you there's an update out there, it's good to follow that. That being said, there's some forms in here. They actually give an example of the form that they use for an in-processing for a sample. And it's, if you go just down a little bit lower here, you'll see in that chain of custody form there. And so one of my suggestions really going forward, and this is probably a goal maybe, you know, with another revision or something is if this was a digitally fillable form, that'd even be better. Meaning that if you have it on a device, you could potentially do it there. In this case, there's a number of forms on here. There's a number of forms that are designed to assist with whether you're getting a list of casualties, et cetera, or looking at sample processing or whatever. These are specifically designed to be printed out and then take a hard copy with you to the scene. So then you can utilize that form, you know, old school. But right now they're just available to print from these. They're not actually interactive forms.
Yeah, and touching on the wave ahead, which we'll have to see how, you know, grant funding, federal grant funding and stuff, how it evolves over the next couple of years. But I did take to our leadership, and there's some interest. It certainly wasn't, yes, you can do that, but is bringing in some federal grant money, maybe to hire a contractor to help make some of that happen. So it's not Colonel Wallace and I behind a computer. So that's one of the things we're looking at going forward, is maybe using some federal grant money to maybe see what you're talking about happens. I think if there's any other sections we want to touch specifically about, the only other thing I could think of is maybe walk through stuff. Do you want to be an exercise lead here and just come up with a scenario?
Sure. The volume works really well in this room. So one question I was gonna ask with the agencies that we have up there right now, how do we activate the CST? Because I don't know that everybody in the room is gonna be familiar with that process. So can you guys walk us through that process real quick?
Yeah, I would say that typically, although we interface directly with all of the fire departments, et cetera, a lot of the police departments, especially in the major metros within the state, and really anybody else that wants to join us. We try to get our name out, and we try to train with those organizations, as you know. And State Hygienic Lab always joins us, State Rad Shop. We have a lot of partners that are also sort of come to those types of events. Although we interface like that, we definitely try to make sure that we are not just a one call for every municipality that has a problem. There are organizations that are going to be quicker to the scene, that are going to be more responsive than the CSTs. Although we're available and we're what we call free chicken for anybody dealing with this type of a problem within the CBRNE space. We are also, we're one organization out of Des Moines, and we don't man our armory 24/7, although we do have a duty officer similar to what Iowa Homeland Security has. So if you call our response number, we don't send it out really to the general public, very much like this is. We send it out within the first responder community, and you can call us and we can advise and assist with any type of a problem, very similar to Des Moines Hazmat, et cetera. But in general, one of the questions that I'm going to ask if I get a call from someone with a problem other than just advising on a specific threat, we'll get into the ERG. We'll look at, we do have a PhD chemist and a physician assistant medical person that's on our staff that is available to advise on those types of situations and symptomology, things like that, if you get something. But in general, apart from advising for deploying the team, normally one of the questions I'm going to ask, well, what other first responder entities are there? Have you talked with Stoner? Have you talked, who's on the ground? And because we are not really what I would consider to be a first responder entity, we're more a second or third response entity, right? And we're a state asset. And so if you're at a municipality and you have a problem, yeah, we may say, yeah, that's something we're gonna respond to, we're in close distance, but we're gonna also call those other agencies to see if they're able to be there. So the long answer to your question is a simple phone call can get us helping with the problem. But then an actual full scale deployment is gonna determine what other assets potentially are we the best asset. There's gonna be some analysis that's gonna come in that say, hey, you know, you have a regional hazmat asset that's probably better. Have they been engaged? If they're not, we'll still probably close distance. We'll mount in, activate our organization, come to our trucks, come to our armory if it's after hours. And we have the ability to go lights and sirens down the road, try it in that direction. But if it's on either side of Iowa, it's going to be a 3 hour or 2 to 3 hour over the road travel time. And that's once we get there and we tool up. So in general for the CST, although we're available to every entity, we definitely try to maintain our position within the right space, right? The right tier, and make sure that we're not, you know, responding where the fire ahead of the fire department or ahead of other entities that possibly should be there. So, but if it does require us to fully activate and come on and help with the scene, one of the key takeaways for those of you, I think most of the people in here understand the CST is we're fully federally funded. So when we do respond for an event, there's no financial tail to it. So we're able to remain generally on scene for up to 72 hours, go full PPE, go in and potentially help adjudicate, figure out a problem, interrogate a scene. If we go downrange, which was considered within our space to be going into a hot zone, we actually need state level approval. So that's Iowa Homeland Security. It's really the governor's office and the adjutant general of the state of Iowa. I'll get on a phone call. It really is, and we'll bring that incident commander on with that phone call. And then generally we'll talk about, you know, is it a problem that we are that falls within our mission set? And it is, it's really a risk decision that's made from the senior leader and senior executive levels. And then they'll tell us, hey, you can go ahead and assist by crossing into that hot zone and then go help that fire department or police department, et cetera, figure it out. Our specialty, as you may know, that's a little bit apart from what other general hazmat teams do is our physician assistant, our chemist, et cetera, they really specialize in nefarious type things. So your anthraxes, your nerve agents, your stuff that somebody might have used in order to try to cause some chaos or some type of a terrorist event. Does that answer your question? Oh.
I'd just maybe add to that, that the activation of these resources isn't necessarily separate active. They are in a sense separate activation, but they're typically not on the respective agencies to make these separate activations. We have a good enough relationship with the CSC that I spoke to earlier that if we get anything, any type of call that even on the service level looks like it falls into any one of these categories, that's usually a text message from myself or Lieutenant Meyers to the CST on duty officer, and usually just to get that ball rolling. So it's typically not something that each activation is having to happen separately. It's usually kind of a common force of power.
And I think I did, I meant to touch on that, but I don't believe I did really well. Is although we do widely distribute that activation number, really the best way to do it is allow that county EMA to engage with those, because we're a state asset, and then let it trickle up. It could come from Iowa Homeland Security. It could go from them to the JOC and then have the JOC notify us. So it could literally, under best case scenario, that make sure that everybody who's, you know, involved in that at every level is aware, and then ultimately it can come to us. Now, if it's very time sensitive, you can give us a heads up. If very much like Des Moines Hazmat is that if we become aware of something, we can start tooling up for it while those other notifications are happening. A phone call doesn't hurt, but you probably got bigger stuff to worry about. Let that EMA solve that problem for you.
Yep. Yeah, so I think the biggest thing there is like to know that local fire and law enforcement throughout the state, regardless of size or locality or anything, knows that these resources are available. So they can, when they contact their emergency manager, they can say, hey, we're thinking we might need X, Y, and Z specialty team. And so they just need to know what is available so they can request it, because it might not be the first thing that comes to that EMA's minds. And then this document, kind of drawing it back to the beginning, is meant then to bridge that time gap between the specialty team showing up and the responders have the information in their hands to deal with it for that initial little bit until the subject matter experts can arrive.
And to give you a good example of that is one of our last real world activations that we got, there was a letter, may have seen it in the news or whatever. I don't know how much news it made, but it was down in Knoxville. It was that letter. And we did receive a call. It was around Christmas time a couple of years ago. And we went to the Army, sort of spooled up, but we weren't really sure that we were the right asset for that. And so we sort of let the situation develop. It was really something that was sent through the mail, and the postal inspector was actually closer and able to go and bring the necessary equipment in order to determine what it was, a white powder incident, determine what that white powder was. And so we just remained in standby at our building. But I guess the point right there is that, you know, we do that mission analysis and then we confer with those other organizations that are could potentially support that event. And then in that case, we just took a knee and said, hey, if you need us, we're here. So.
All right, we can either kind of jump through the document a little bit if you want stuff, or we can open for questions, however we want.
I was gonna say, if we want to open for questions real quick, and then we can throw a scenario out there after that.
Okay.
Maybe that'll queue up some more questions too.
Yeah.
Any questions?
Tad, is everyone on Des Moines Fire required to be like a technician level hazmat then, since you're a contractor for that, or how does that work with your staffing?
Oh, that's a good question. So our baseline is hazmat operations level. For those that aren't aware, there's different levels of hazmat training. Hazmat awareness is the base level, operations level, then technician level. All of our members are trained to operations level. That's a kind of standard procedure with getting your firefighter 1, firefighter 2 certification. And then people on our hazmat team are firefighter or our hazmat technician level trained. So we have approximately 45 hazmat technicians employed on the fire department, split between 2 stations and their missions. There is some overlap. There's a little bit of difference in missions between the 2 stations. But we can complement either station with technicians depending on the scale of the incident.
If one of those counties that you're kind of contracted out with calls though, you'd have personnel in-house like at that time to deploy them.
Yep, we obviously the 45 personnel is divided over 3 shifts, so we have the approximately 15 technicians on duty at any given time. So like I said, we cover, so from a hazmat team perspective, we cover Des Moines, like I said, and most of the surrounding communities, most of the surrounding counties. But we are also one of 3 WMD teams in the state of Iowa. So along with Council Bluffs and Davenport, we can be deployed statewide based on a WMD response.
All right, I'll throw out a little scenario then, I guess. Maybe it'll queue up some more questions. All right, show choir competitions have become a big thing here in the metro area. Did not know. So the scenario I'm gonna throw out there, one of the school resource officers finds an unattended bag in an area of the school that hasn't been occupied by the show choir stuff. So what kind of response would that entail to start with?
So as far as this document's concerned, then the first thing you would want that school resource officer to do would be go to tab 1. So he or she could try to figure out, based off the information in tab 1, what type of a hazard they're dealing with. We can look at that briefly. Talks about just suspicious items in general there. And then there's some kind of overview stuff for accidents involving CBRNE hazards. The initial isolation for a lot of these is going to be based off of the ERG anyway, because you're not going to have the ability necessarily to scan for the exact hazards you're looking for. So you just want to kind of scroll down and we'll choose what type of hazard we think it is. So then it jumps into recognizing by each specific category. The first one's a chemical hazard, and there's some bullet points there that, okay, if you're seeing any of these around the suspicious bag, is there any illness? Is there, sudden onset illness, blast or explosion, unexplained liquids, colors, odors, sprays, anything like that? If you just want to keep scrolling, we'll look at each of the hazards really quick. So then bio, again, some stuff you'll want to be looking for to try to help figure out if it's a biohazard. You're not going to have likely sudden onset of symptoms like you would with a chemical hazard. You can keep going.
I would say a lot of these indicators too are based on an entire picture as well. So you're not just taking a backpack as a suspicious item. You really have to take all of the indicators into a context here. So, a good indication difference between a chemical and a biological would be like if someone's experiencing symptoms at the scene. A lot of times chemical exposures would have that immediate onset of symptoms, as opposed to biological that would have a much more delayed onset of symptoms. So it's really a bigger picture that goes into this recognizing the indicators portion of it.
Yep. Sorry, for these purposes here, rad nuke are lumped together. Nuclears, thanks to our friends, our health physics friends, there's a lot of reference material on the end here for stuff they enjoy day to day, but sorry, I cut you off.
No, I think that in general, so when you talk about an unattended bag, within the CBRN community, really, there really is for most part, there's really a big difference between an unattended bag and a suspicious bag, right? So it really has to do with the intelligence. So if you have a known threat actor, somebody that has been known, or there's some intel out there that says that somebody is threatened that event or personnel at that event or something, or there's something about the bag, either symptomology from people that have handled it, or wires, or just the circumstances of how that bag, what makes that bag unique to be just, it's not a book bag that somebody left, because you don't want to spin up an entire state response for a book bag that somebody left. So there's a little bit of a phased interrogation that you need to do with that. But for purposes of this discussion, I think we're assuming it's a suspicious bag.
Yes, so I wanted that school resource officer to kind of look at these identifiers, and then looking at it a little bit further, they see a large 8x11 manila envelope with a white powder falling out of it.
There you go.
So in that case, I would go back probably to the bio or the chemical, could be either or. And you'll then scroll down just a little bit more for bio, for example, and then you'll click there where it says tab 3 biological hazards. Takes you to that tab. And for biological hazards, here's what you want to do. First, again, this is the AIN of the RAIN. So the R is the entire first tab. So you're just trying to recognize what type of a hazard you're dealing with. Then when you get into the tab for that specific hazard, now it's avoid, go to a safe location, stage your operation, stay uphill, upwind. Isolate, you want to set up a perimeter to the ERG based, and you're still dealing with an unknown. 99.9% you're dealing with an unknown. So you're going to do the 330 feet, 100 meters. Confine contaminated, exposed victims to a restricted or isolated area. And then you're going to notify, and you're going to decide through that process that we've discussed whether or not there's going to be additional resources sent that way.
So for first responders looking at this and dealing with an incident, this is obviously, a decent amount of information to just be throwing at them. I would instruct this the way that I would instruct the ERG, the way that we reference an ERG is use it as a checklist. It's in this specific order for a reason. So you don't have to digest all of this material just in one sitting. Use it as a checklist for those initial responders, and just start at the top and just go one by one to make sure that you you hit all your benchmarks, on that page.
And with that said too, use this document for training purposes, exercise purposes. I'd rather have you guys utilize it that way, get used to using it, feel it out for one, then you can be familiar with it. And two, on a foot stomp feedback, we would love feedback and see if it is working through you guys using it at the exercise and training level. I think that'll give us a good opportunity for you guys to provide us feedback. Then we can sit down as a group and make these corrections or updates or however you want to say it. But when you get a group of what, I don't remember, 8, 10, 12 on the cover of this, it's how many different people we have sitting around the table. In some agencies, it's 2 people and they're trained in there. Like I said, that our friends that are health physicists are part of this. The hazmat is part of this, SHL is part of this. And so until the document's used and the feedback's provided, it's hard for us to sit around a table and make it the best thing that it can be.
So Brett, the one section we really haven't gone over at all is the explosive section. So if we can scan to that real quick.
Yeah, jump to that. And that's a good point. I'll let you talk about it. Stuff will be, that was one of he brought in some subject matter experts to help with that part, but there was some thought put into whether or not we wanted to leave that, but it's it's probably one of the most common hazards, realistically, as far as a terrorist type event. So we wanted to include it. There are fewer specialty teams, or I guess not represented at this table anyway, that would be dealing with explosives. So
Yeah, so the reason we included this, it's part of the CBRNE stuff, but also this is something that it may be in combination with one of the other portions. Biggest thing with that, we're not giving away, we're not saying what they're doing. We're kind of giving you, again, that RAIN concept. And then if I remember right, the page after this actually gives a little bit more information because it's specific to the standoff distance for the type of thing you're dealing with. But we really wanted to bring those folks into the fold because a lot of times, unfortunately, because they're not associated with either a hazmat team or the civil support team, they sometimes get forgotten, unfortunately. Then Brett, if you can pull up the ESF 10. So the other thing that we've done with our hazardous materials emergency support function is we've kind of incorporated the RAIN concept into our stuff as well. And we did this intentionally, so we were aligning with the CBRN protocol and really identifying what we needed to do from a local level. So it provides a quick overview of what each step is. And then really then go into the stuff that we need at the local level. So our planning and assumptions, who's doing this, and this plan is reviewed, or this emergency support function is done every year. So if you did not get a chance to look at it this year, it's out there, it's available. Go ahead and make comments and give me a review feedback and we'll incorporate what we can. So this really talks about all the local level stuff that we need to do in association with our LEPCs, our billing procedures, the hazmat team, the CBRN protocol. It talks about all that stuff.
you want to talk about, we didn't mention the decon section in there a little bit.
Yeah. Tab number 7 is decontamination. So there's some good pointers in there as far as directing decontamination of any exposed individuals. There's a couple contrasts and maybe some previous trainings on what decontamination looks like. The hazmat team has undergone some changes in decontamination procedures and injected kind of some practical aspects into that. So that in turn has kind of transition some of our training aspects that we hit on. So some things to keep in mind, if someone is contaminated with a dry powder, generally the training has always been to brush it off, right? Well, that's kind of aerosolizing it. So we really want to hit on the fact that we're more dampening and blotting any dry powders that we're hitting with or that we're trying to decontaminate. The other big kind of, I don't want to say change, but thing that we try to hit on with this was not everyone that is exposed, use exposed carefully, but not everyone that is exposed needs decontamination. There has to be a decontamination triage that goes into place, and there's a flow chart, if you scroll down there. That's really based on if someone is contaminated or if they're symptomatic. And if they meet any one of those two criteria, then they'll go through decon. It's really kind of more driven towards a mass decon scenario, and we really don't need everyone going through decon. That's going to be a challenging process trying to herd everyone through. So if we can do a decon triage, that can make that logistically a lot easier for us. Other than that, there's just some other considerations as far as decon, mass decon, apparatus-based decon as well too.
You'll see some of these, there's links, either QR codes or links. It's kind of a variation there. It kind of goes back to getting some technical experts in there to help us make it a little bit more unified, but these are references that are tried and true. CSTs, WMD hazmat teams, they've been training with these organizations and along those guidelines for a long time. So instead of the very first iteration of the protocol would take a lot of that information and incorporated it into the actual document, which is why it got so big. We've decided just, again, going to more of the electronic format. We'll just take you to their site instead of having a 200-page document. So.
Do you have any other questions for the group here? I do think from reading this beforehand myself here, the last tab here, the termination and transition of the incident, just as you guys have kind of talked about before, with this being available to not only the responders, but maybe people that are in a facility working around things that could contribute to an incident like this. Some of the reminders here in terms of communication with partners and notifying public works, hospital, EMS of some of those different things. I think it looks like a very solid document in terms of that, of just having those little reminders, those little taps on the shoulder to go through, as you said, to use. And I think Ted said as a checklist type of document. So again, from my perspective, looking at it with less of the hazmat background than Cameron has had, I think this is achieved what you've said to set out here to make it a little bit less of something that's an intimidating document or something that is highly technical to something that someone can go to, look through, get the basics, get those information and fill that time between when someone less experienced is on the scene trying to recognize and contain to when we get our experts there. So kudos to you guys.
That's a good point. The depending on the scale of the incident, it's really either way. It's going to end up back on that incident commander, unless that the command is handed off at some point. It's going to end up back, and so we thought that was important. Cameron was a proponent of having this termination transition stuff remain too. So a lot of this is still kind of the core of what was in the old protocol. So there was some good stuff that was kept out of the old one.
We also knew that not every question was going to be able to be answered by the protocol. So the old version really tried to answer every single question. And that's part of what made the old protocol 170, 190 pages. But having some of that, we still have that as a reference material. We did keep all of that stuff. So if we need to go back to it, we can. But it's definitely not for a first responder level necessarily. One of the big sections, and thanks for scrolling to it, Brett, that we did add was responder mental well-being. You can see time and time again that the responders are having a hard time with some of these incidents. So we did include that in here as well. And I know not everybody got a chance to read all 70 pages of this document, which is down 100 pages. But if you do have questions throughout, email us at emergency.management@polkcounty.gov. And we will get to the right person to answer the question if you do have any as you go through it.
I guess to really quick, you just jump back to the table of contents. That just reminded me that 70 still sounds like a lot of pages, and it is, but if you look at that, all the annexes after the tabs, that's information that we thought is still important. But it's not gonna be that initial, what you need to know, what you need to do right now. So in reality, we're really down to about under 40 pages of this is what you need to do as you navigate this incident, whatever it is. So, and then a lot of the annexes is some of that kind of expanding on information, especially under the rad new portion. It's still pretty lengthy. Some good information there too, but not what you need to respond to that incident initially.
Okay, well, if we don't have any other questions, I will just go ahead and remind you again, if you have a chance to fill out your evaluation form, just flip it over on the desk. We'll collect those afterwards. Our schedule coming up in the next few months, we're going to have for March, kind of a review of public and private partnership response to disasters. We had plenty going on in 2024. So we've got Hy-Vee disaster response and hopefully a couple of local EMAs that are going to join us and kind of go through what worked well, what didn't work well, how we can improve there. Damage assessment with the update of our ESF3 public works will be coming up in April. In May, we are planning to work on a seminar with the National Weather Service on event action plans for special events, outdoor events. And in June, it looks like Iowa Legal Aid. So those will be popping up on our website as we go, as well as our usual email list. That's what we've got on the docket there. But again, anything, other topics that you would like to see, that you would like to present, we are open to all of that. We'd like to thank all of you again for joining us here today and get you out on time and enjoy the rest of your afternoon. Thank you.